Abdominal Prep. Please note that for demonstration purposes, the iodine solution will not be applied to the surgical mannequin. The surgical prep involves application of an antiseptic solution to the patient's skin for the purpose of reducing the microbial count on the patient's skin to an irreducible minimum because the skin cannot be sterilized. The purpose of performing the surgical skin prep is to eliminate transient microbes and reduce the activity of resident microbes on the skin. The skin prep is performed prior to initiation of the incision of an invasive surgical procedure. An abdominal prep to accommodate a lower abdominal midline incision will be demonstrated. Typically, a preassembled kit that includes a pair of sterile gloves is used when performing the skin prep. The kit is placed on a prep stand, which is positioned to allow the individual performing the procedure to use their dominant hand most effectively. For example, a right-handed individual may choose to place the prep stand on the patient's right side, while a left-handed individual may select the patient's left side. In addition to the prep set and the prep stand, it may also be helpful to position a trash receptacle in a convenient location for use throughout the procedure. Be aware of the patient's allergy status and be prepared to use alternate supplies if necessary. In this situation, the patient is allergic to amoxicillin and will not be necessary to use alternative materials. If the patient is awake, be sure to identify yourself and explain the procedure you will be performing. Today, the patient is asleep, and we will move forward with exposing the surgical site, turning on and positioning the lights. If necessary, hair is removed prior to performing the skin prep. Inspect the outer wrapper, which is sometimes called a dust cover, to be sure that it is intact and then remove and discard it. As the dust cover is removed, verify the integrity of the inner wrapper to ensure there are no holes or watermarks. If any damage to either wrapper is noted, the item should not be used. Place the wrapped prep set at the right front corner of the prep stand at a diagonal with the top flap facing away from you. Plan carefully, because once opened, the wrapper may not be relocated. The wrapper is opened using sterile technique, and the wrapper edges, called flaps, are opened sequentially, opening the flap on top first. Grasp the corner of the first flap and open it away from you, touching only the corner and the 1 to 2 inch perimeter of the wrapper edge. Use caution not to reach over the exposed sterile portion of the partially unfolded wrapper. Grasp the tab of the second corner and open it laterally. Extend the wrapper edges to the side so that the wrapper lies flat. If the wrapper edges flop back onto the sterile area, the prep set is considered contaminated and must be replaced. You can avoid contamination by holding the already opened edge with one hand as you open the next corner. Grasp the tab of the third corner and open it laterally, continuing to follow the rules previously outlined. Grasp the tab of the fourth corner and open it toward you, allowing at least 12 inches of space in all directions. If sterile gloves are included within the prep set, secure the glove package by pinching the center of the glove wrapper and lifting the gloves up and away from the prep set, allowing at least 12 inches of space in all directions. Place the glove wrapper on a flat surface, open the package, and don the sterile gloves using the open gloving technique that you learned previously. Organize the supplies within the sterile field. The towels with the impervious barrier are used for draping, and the absorbent towels will be used for drying. Set aside the towels within the sterile area of the wrapper with the drape towels on top. Identify and apply the solutions to the appropriate applicators. The prep solution is applied to the winged sponges, and the paint solution is applied to the sponges with the handles. Be sure to thoroughly read each label and verify that the expiration date on each solution has not passed. A sterile drape is applied to each side of the abdomen to serve as a barrier between the prepped and non-prepped areas, and to prevent prep solution from pooling under the patient's body. Lift the first drape towel from the prep set and open it. Grasp the corners of the towel with your thumbs away from you, and roll the towel over your gloved hands to protect them as you slip the towel under the patient's torso. Allow at least 12 inches of space in all directions to ensure that the towel does not become contaminated by touching any non-sterile area, including your scrubs and the exposed skin of your arms. Repeat the procedure with the second drape towel, which will be applied to the opposite side. It will be necessary for you to walk around the table to apply the distal drape. Dip the cotton-tipped applicator in the prep solution, transfer it to your dominant hand, and clean the detritus from the umbilicus. Discard the applicator after use and repeat as needed. Please note that school or facility policy may require this step to be performed later in the prep procedure. Use your non-dominant hand to secure one of the wing sponges soaked in the scrub solution. Transfer the sponge to the dominant hand, hold the wing so that your gloved hand does not come in contact with the patient's skin, and begin to wash the prescribed area, starting at the intended incision site and working in concentric circles until the perimeters of the prep are reached. In this situation, the perimeters of the prep for the lower abdominal midline incision are the inner mammary line, the mid-thighs, and bilaterally, as far as possible. The groin is the last area to be prepped with each sponge. Each sponge is discarded after use, and the procedure is repeated until all sponges have been used, or the necessary amount of time has elapsed. Lift the first absorbent towel from the prep set and open it. Grasp the corners of the towel with your thumbs away from you, and roll the towel over your gloved hands to protect them as you lay the towel on the patient's torso. Allow at least 12 inches of space in all directions to ensure that the towel does not become contaminated by touching any non-sterile area, including your scrubs and the exposed skin of your arms. The prepped area is dried using a patting motion. Pinch the far edges of the towel and peel it toward you to remove and discard it. Be sure that you do not lift the towel and do not crumple it prior to discarding it. Simply drop it into the trash receptacle while maintaining a safe 12-inch distance. Repeat with a second towel if necessary. Use your non-dominant hand to secure one of the handled sponges soaked in the paint solution. Transfer the sponge to the dominant hand, hold the handle so that your gloved hand does not come in contact with the patient's skin, and begin to paint the prescribed area, starting at the intended incision site and working in concentric circles until the perimeters of the prep are reached. The groin is the last area to be prepped with each sponge. Each sponge is discarded after use, and the procedure is repeated until all sponges have been used. It will be necessary for you to walk around the table to remove the distal drape. Remove and discard the barrier drapes from the periphery of the prepped area without disrupting the prepped site. Discard the used supplies and remove your gloves using the glove removal technique that you learned previously. Continue to provide support to other team members or care for the patient as needed. Wash your hands as soon as practical, and remember to document the procedure in the patient's chart.